Hi, I'm Dr. Richard Hammer, and I'm here demonstrating our new teaching tool called PathEdEx. And our first volume is a hematopathology atlas. I'm going to walk you through some demo cases here. So what we've done is compiled demo cases, and you can see the little bubbles on my screen dancing around. Those are tracking my eyes. So what we're doing is doing gaze tracking and are able to record and evaluate what you're looking at on the screen. The utility of this is that we can identify if you're looking at the right diagnostic clues, and then you can improve your score and your performance by knowing what clues to look for. So we're going to walk through a case. Here we have 7 demo cases for you that are available online. We're going to walk through one here. And this is a case of an 86-year-old female who presented with a parotid mass. You can see again the little bubbles following my gaze here. Radiology was done, and we have x-rays available for interpretation. And then this patient had a biopsy of the base of the tongue from the parotid. And we have all kinds of options for you. And we've made this more like a real-life experience. So you can order additional stains. You can look at flow cytometry results, molecular diagnostic results, cytogenetics, or of course look at the H&E stains. So I think the first thing we want to always do is make sure this person had no previous material, and she doesn't, but we got a $10 bonus for checking. So we keep scoring this by money, which is how it works in real life. You can spend a lot of money making a diagnosis, or you can spend a little money making the right diagnosis too. And so this will be your scorecard, is how much money did you spend or how much money did you waste doing unnecessary testing. So we're going to go back to the H&E stains here. And we have 4 slides here. We're going to pick one. And these are whole slide images that are scanned. And you can move the whole slide around and, of course, zoom in and zoom out as you want and move around just like you might drive it on a microscope. So here you can see again where my eyes are looking, starting at low power, getting an architectural assessment here. And I see there's this multinodular mass that is got some fibrosis but is composed of smaller smaller nodules that look like to be small lymphocytes, at least from this power. And as we move in, we can see that, yes, there's these small nodules that are back to back. And we can go into very high power, just like you would do on a microscope at 40x, move around and see that these are small, pretty irregular lymphocytes. So we're done maybe looking at the H&Es. You might want to spend a little more time, and we want to see if we do any ancillary testing. The first thing we might want to look for is flow cytometry, and we see flow cytometry was done and gives us a phenotype of CD19, 20, and 10, the monotypic lambda population. Molecular diagnostics and cytogenetics were not performed in this case. So now we're ready to make a diagnosis based on the information we have. So we click the bottom bar here, and we have 4 choices. In this case, it's pretty characteristic of a low-grade follicular lymphoma, WHO grade 1-2. And we see that that is correct. We had a financial impact of $530 on this case because we kind of did it based on the H&Es and flow cytometry without a lot of extra testing, which would have been unnecessary in this case. If you'd like to see an additional explanation, we can see that the correct answer is follicular lymphoma, and then there's bullet point type information about why the other diagnoses are incorrect, and to highlight the differences between the correct diagnosis and the incorrect diagnosis. And this is a good way I found in my studying back for boards and things like that, is I don't want to just know the correct answer, but I like to know why the wrong answers are wrong. So this will explain that. So now we can go to a gaze player. Okay, so now we want to analyze our performance. So this is the utility of this tool, is it's like a video game. You can get a score, and then you can see how well you did. It took me 2 minutes and 55 seconds to make this diagnosis. I got 2,785 points. And if we click on the play track, we can see it's like a little movie where my gaze went. This is a great tool because not only can we analyze this data, and what you're seeing here are pathways, which are the little lines in a streaming pattern like that, and then clustering, or what we call focus regions, where I'm paying attention to a specific cytologic or histologic finding in that area. So you can track your gaze and then compare it to mine as an expert and see if we're looking at the same things. Not always is the area that I'm looking at might be similar to another area on the slide, so it doesn't have to be the exact same area. What we're interested in finding out is whether you're seeing the identifiable diagnostic features there. We can then analyze all this data and compare it to our expert analysis and see whether you are or are not seeing the diagnostic features that may be present on the slide, and getting the correct diagnosis. Now I guess it's done.